Hi, my name's Keith, and I'm here to tell you about nurse turnover and retention. Organizations are currently experiencing difficulty in staffing nurses who are integral to patient care. So, do we need to train more nurses? Well, actually, there are currently 5.6 million licensed nurses in the United States, which is more than ever. So, why are organizations experiencing a shortage? Well, the short answer is that healthcare employers are failing to attract nurses and to retain them once they are hired. So what does nurse turnover cost? Currently, the average nurse turnover in acute care hospitals is 16.4%, which, although is down significantly from the 27% during COVID, it's still elevated. The 2025 NSI staffing report states that the average cost of nurse turnover is just over $61,000 per nurse. Each 1% change in the nurse turnover rate either costs or saves a facility an average of $289,000 per year. In 2024, the average acute care hospital lost $4.75 million due to nurse turnover. In a recent study examining the reasons for nurse turnover in New York and Illinois, 7,887 nurses who recently left healthcare responded to a questionnaire which asked them to report their major factors for leaving. And it was found that between April of 2018 and June of 2021, 39% left due to retirement, but 26% left due to burnout or emotional exhaustion, and 21% due to insufficient staffing. The age distribution of respondents was similar to the current nursing workforce, which suggests that there exists a supply of experienced and licensed nurses that could be attracted back into healthcare. Of note, most nurses who left healthcare didn't cite COVID as the main reason for leaving. Other listed reasons for leaving included a lack of administrative transparency, rigid policies surrounding difficult shift schedules, hostile work environments, and an inability to effectively find a work-life balance. Research has shown that a large number of nurses report their sleep quality and overall health as poor or fair. So why is high nurse turnover bad? Well, I feel like the implications are relatively obvious. Inadequate nurse staffing has been shown to result in poorer patient outcomes. Poor staffing leads to more unsatisfied nurses and further burnout and turnover in a vicious cycle. Many recent studies have allowed nurses to voice their opinions on what they would like to see implemented in the workplace to increase satisfaction. Employers can create policies to define and ensure safe nurse-to-patient ratios. They can give frontline working nurses a voice by including them in organizational decision-making. They can ensure a strong nursing presence in upper-level organizational management. They can create compensation packages and programs that take into consideration shifts that are harder to staff, such as nights, weekends, and holidays. They can provide services such as on-site daycare, consider programs for more flexible scheduling, and enforce a workplace culture of positivity. Recent studies have also shown that programs designed to transition new graduate nurses into the workforce and programs that provide mentorship for newer nurses result in increased resilience in the early stages for new nurses. Another significant factor shown to influence nurse turnover and also patient outcomes is the investment in evidence-based practice. A study done in 2023 surveyed chief nursing officers and found that nearly 2/3 of respondents allocated less than 5% of their budget to evidence-based practice, and the other 1/3 reported no investment in evidence-based practice. These same authors conducted a similar survey in 2016, which showed very similar numbers to the more recent study, which indicates that not much has changed in the last 10 years. Evidence suggests that increases in evidence-based practice budgets are associated with fewer adverse patient events, a stronger evidence-based practice culture, and, you guessed it, reduced nursing turnover. In summary, there is a current nursing shortage, but this is not due to a lack of nurses. Nurses are leaving healthcare, and because of emotional burnout and insufficient staffing. This turnover is costly both for organizations and for the patients under their roofs. A few things can be done to create more satisfied nurses, less turnover, and better patient outcomes. Ensuring nurses have a voice in organizational decision-making, provision of competitive benefits, positive and supportive workplace cultures, and investment in evidence-based practice all can have positive impacts on this crucial issue. Thanks for watching.